Our topic tonight, ladies, is birth control, and I've never felt less qualified to talk about anything in my life. So we're just going to jump right in. Kelly, and there's no delicate way to transition to this either. I always like to just start with you and say, so what has your journey been like? What have the conversations been like surrounding birth control with you? Is this something you sat down and talked to your provider with? Is this something you've had a conversation with your mother with when you were a young woman? Where are you at today? Give us a little insight on that.
So my journey with birth control began with whatever free samples my college nurse had to dispense. Okay. And I would just go in and collect the free samples and let my hormones just have an experience that they probably weren't trying to have. So that was sort of my beginning jumping off point. And I have used a lot of different things over the years. Like, I think a lot of women just sort of like throwing stuff at a wall and seeing what sticks. I've used the IUDs and the patches and the pills and all of the things. These days I let my husband take care of that. After we were finished having children, I was finished with birth control. But my question is, like, I feel like my experience mirrors what a lot of women go through, which is just like, I don't know, prescribe me something. So how do I know, how will someone know what is right for them?
Yeah, I 100% echo that your experience is not unlike a lot of women. You know, I think there are so many options now, which is awesome, that we've come a long way from very limited resources in this area. But that makes it a little bit more challenging. And even as a healthcare provider, you know, I went through several for myself as well, because it is a little bit of a trial and error. You know, the big answer, the easy answer is, how do you know which one's right for you? It depends, you know. There are a lot of factors to consider where you're at in your family journey, or you know, relationship wise. You know, are you with a stable partner, considering children in the near future? Are you, you know, nope, kids aren't for me at all? Are you,
right,
you know, still trying to find the one, not really sure where you're at with that? Those are considerations. You know, you may have other religious or cultural values that play into your decision as well. And then there's medical conditions that can sometimes influence, you know, which particular type of birth control we can offer to you safely. So the short answer is, it really depends, you know.
It really just depends.
You really
individual decision, individual conversation with your provider and that sort of thing. Talk us through a little bit some of the different options that are out there, Dr. Moen. And you know, I don't know if we need to get into pluses and minuses of each. I'm sure there are both on every side of everything, but talk to us about some of the options out there for women today.
Yeah, well, so a lot of times when I have this conversation in my clinic with patients, which is often, I kind of break it down into a couple of, you know, buckets. Yep. You've got kind of hormonal buckets and non-hormonal buckets. Hormonal being medications typically that are going to influence the way that your body's hormones produce the ability to either fertilize the egg or release the egg. And non-hormonal, typically falling into more of your barrier type methods, things like condoms, vaginal diaphragms, you know, spermicide, pull out,
yep,
all of the fun methods that continue to get less and less effective down the list as I named them. So condoms being your best at, everything else not so good.
Okay.
So as far as hormonal goes, you know, we have, again, a nice variety of options in that bucket. And even in that bucket, I sometimes then break it down into our combined contraceptive options and our progesterone-only contraceptive options. So typically your combined contraceptive options include the typical pill, the birth control pill, you know, goes by lots of beloved names. Very effective. Often people like it a lot. Downside is you have to take it every day, and you have to take it at the same time every day, or it loses its effectiveness. Taken properly though, excellent medication. There are different versions of the concentration of our different hormones within different brands. So again, gets very nuanced even in that one particular kind of birth control. So those are things that you can work through with your provider as well. Other kinds of combined options include the patch. You mentioned that, Kelly. I really like the patch as an option because it's similar in its hormonal profile to the pill. So benefits including, you know, acne, regulating your periods, making them less heavy, all those fun things, including not getting pregnant. But without having to remember it every dang day. Put a patch on, you kind of change it once a week, a little easier to remember. Still got to remember to change it on the same day every week, all that kind of stuff. The biggest downfall I see with a lot of patients is sweat, and then it falls off. And now what do I do? So if that's, you know, again, a particular issue for you, maybe this one isn't, the patch isn't quite right.
Got it.
I feel like I'm already missing another combined one, but then in your progesterone only, you've got a bunch of options as well. So you've got the IUD or intrauterine device. There are several different brands now of that. Mirena, Skyla, I think there's one other one that I'm already missing too. And the variation of those is just for how long they're approved to be in the uterus. And a little bit of the device itself looks a little different. But at the end of the day, all work effectively the same by kind of having that progesterone, which decreases the uterine lining, making you less likely to become pregnant, about 99% less likely. So, and then there's the Nexplanon, which is the ARM version of the progesterone releasing medication. Same kind of benefits. A lot of people will see that their periods almost shut down with that, but it goes in the arm. It's good for 3 years. So again, not invasive, but still something in ya. So people sometimes freak out about that, you know. So there's all of these nuances that it's a wide variety of options, which I keep saying it's so great that we have all of these now to try, but it a little bit of trial and error and find the one for you.
I don't know if that works for you. I really can see the benefit of the one that the non-daily, you know, I can see that being a big appeal for a lot of people in terms of having to take it on a regular basis and those sorts of things too. Interesting. I think bottom line in the conversation, if you're struggling, if you haven't found the right mix for you, it's a conversation with your provider, right, Adrienne? And just we can kind of try some recommendations on some different things that might work for you, correct?
Oh, thank you, Dr. Holm. I knew I was forgetting one. Dr. Holm just commented, the NuvaRing is a vaginal insert. That is our other combined contraceptive option. Thank you.
So she's got your back tonight. I love it.
I love it.
I have a question.
Yeah.
So for people that are in that in-between space of trying to figure out what works best for them, I know a lot of people will turn to a morning after pill or a plan B just as like, you know, I wasn't really sure what I was going to use and, you know, things happen. And I know those aren't supposed to be used as, you know, your birth control method, they always say, but I'm curious why that would be.
Ooh, boy, you're going to try to stump me here, Kelly.
Oh, well, sorry, I'm not trying to stump anyone.
But I think the bottom line, why you wouldn't really want to use that is it's not as effective. So the morning is about 80%. So there's some, you know, and that's if you take it for sure the morning after, you know, within the 72 hours, like just as the manufacturer meant you to take it. So their effectiveness there is probably the number one reason I would say that it's really not meant to be like the option that you choose.
Gotcha.
Just like you're looking at like 30 to 70% effective there. So
yeah, I don't like those odds. That's
whereas you know, medication, sterilization, or IUDs, or Nexplanons, they're about 99% effective. So for a reliable and safe option, you really don't want to rely on something with that level of failure.
Yeah,
that makes sense.
big drop. That's a big deal for sure. Okay.